Dear Chairman, dear colleagues, thank you for having me here today. I'm Luigi Pannone from University Hospital of Brussels in Belgium, and I will talk about in vivo mapping of human sinus node and preferential conduction pathways. So what is the sinus node? The sinus node is the electrical central of our heart. So it's a crescent-like shape of around 13 millimeter. It's insulated in a fibrous sheet, and it's an epicardial structure. So you can see here that from histological pictures, the sinus node is embedded in a fibrous sheet. It's to protect the sinus node and also for electrophysiological properties. Also, the sinus node is typically an epicardial structure for most of its extension. And as you can see here, we have the sinus node extension. So it's like small channels going from the sinus node to the surrounding tissue. And we'll see later that this is important for conduction and for activation from the sinus node to the rest of the right atrium. So this is about the embryological origin of the sinus node, and this is what we do in the lab. So for you that visited our lab, you might have seen me or Professor De Asmundis doing this map in the hybrid. So we put in an endocardial catheter and we map the right atrium. So this is an electroanatomical map of the right atrium during hybrid ICNT procedure. And you can see here in red, this is the sinus node exit. So this is the exit of the sinus node on the endocardium. Of course, it's an epicardial structure. So what we can see from the endocardial side is just the exit of the sinus node. And here you can see beautiful colors as we like in EP, so that we see the activation from the sinus node to the right atrium. And why is it important to study the sinus node? Because we have diseases that come from the sinus node, like inappropriate sinus node tachycardia. And sinus node tachycardia is characterized by an accelerated heart rate, more than 100 beats per minute. And we in Brussels developed this approach for inappropriate sinus node tachycardia, that is an hybrid approach where we go in with the surgeon, Prof. Lamer, and we perform an epicardial ablation. As you can see here, we perform superior vena cava isolation, crista terminalis, and inferior vena cava isolation. And this is the map. So you see this is a right atrial map with the Orion, with the arrhythmia. You see that the superior vena cava is isolated. We have a crista terminalis line. Inferior vena cava is also isolated. And so when we were performing these procedures, we were curious about mapping the sinus node. Why this ablation works? Where is the sinus node? So these are all questions that we tried to answer with this publication. So me with Ivan Eltsov and the team of UZ Brussels performed these studies, and these studies come from the endocardial and epicardial map of the sinus node during hybrid procedure. So this picture that you see in this slide, it's very interesting. Why? Because this is the first case in the world of endo-epi map with a FERA system in the hybrid setting. So we were not sure if the system was going to work, and we tried, it worked. So you see that the sinus node is exit zone on the epicardium is in red, is depicted here on the left, and you see the spreading from the sinus node, the epicardium, and to the surrounding. And again, here down you have the endocardial map. So we also perform studies with the HD grid. So you see here in hybrid setting, so the HD grid is the catheter in white with the white arrow, and this is the thoracoscopic view, so from the incision on the right chest. So you see the azygos vein, and I'm manipulating the catheter in the superior vena cava. So the SVC you see up on the right, and the catheter is going down from the SVC, and down on the left the sinus node and the sinus node artery. You can see very well the artery and the sinus node. The catheter is just lying on the endocardium, just under the sinus node, that is an epicardial structure. And what we do, we finish endocardial map, and then Prof. Lamer map, as you can see, epicardial mapping here down on the right. And what we observed, as expected, of course, the sinus node is an epicardial structure. So the activation time is earlier on the epicardium compared to endocardium, and it's like 50 milliseconds before on the epicardial side. Also, we found a new and interesting finding for people that love EGM. So we found a bipolar EGM reversal polarity at the first activation site. So as you can see here on the right, for two contiguous electrodes, C1, C2 and D1, D2, you can have like a mirror image. So you see the electrogram is positive, negative, and negative, positive. So it means that the first activation site is exactly between these two electrodes. And we also find something interesting. Actually, if you map the SVC, there are sleeves going inside the SVC. And we found that if the patient is older, the sleeves are shorter. If a patient is younger, the sleeves are longer. And why this is important? So now we are collaborating with the Visible Art Lab, with Prof. Yates, so with Neil Duong, to perform this new study about peak frequency mapping of a human sinus node. So what we do now is we map with HD grid. It's only endocardial mapping, and we included 44 patients in the ICNT group. So in upper sinus node tachycardia, 10 patients with the 6 sinus syndrome, 10 patients with the control, so normal people just doing AV NRT ablation. So we perform endocardial map with HD grid, and we perform an activation time map and peak frequency map. So you can see here on the right, this is an activation time of the right atrium. You can see the sinus node. The sinus node is the small white circle, and you see the arrows. The arrows are the conduction pathways. As you can see, these are defined based on the activation vectors in green, and you see a superior activation pattern. So you see a superior pathway, inferior pathway, and a pathway that goes to the right. That pathway, it's interesting, as we can see later, because this pathway is the Bachmann bundle. So we asked ourselves if the peak frequency could help us to visualize the sinus node and the conduction pathways. And the answer is yes, we can. We can visualize these activation pathways with a peak frequency around 350, 450 Hz. So we select this narrow band of 350, 450 Hz, and you see that all of a sudden it's highlighted what we want to see. So the sinus node is highlighted, and is highlighted the conduction pathways, the superior, inferior, the anterior pathway, and the Bachmann pathway. If we change, we put 320, 470, you see that some areas appear in the red circle that are not what we want to see. So it's not specific. So the best cutoff are 350, 450. And you see a good overlap with the sinus node area and the conduction pathways. Based on this, we calculated that on this peak frequency band, we have an overlap around 60%. And this overlap is higher for ICNT patients and controls compared to 6 sinus syndrome. Why? Because this is the example. So on the left, a patient with an upper sinus node tachycardia. You see that the sinus node is a high frequency, and you see that there is a superior conduction pathways going up, inferior conduction pathway going down, and the septal pathway that is the Bachmann bundle. And you see normal sinus node in the middle. Again, the sinus node is a high frequency, 350, 450 Hz, superior conduction pathway, inferior conduction pathway, anterior conduction pathway, and the Bachmann bundle that is going up on the septum. In 6 sinus syndrome is different. So this patient has a sinus node that is diseased. So what we have is that the peak frequency is low. So you see that the sinus node is not highlighted, and you have just a superior, an inferior pathway and the anterior pathway. So there is a complete lack of a superior pathway. This is typical of 6 sinus syndrome. Again, other 3 examples, again the same. So sinus node is high frequency in ICNT and normal sinus node with the full overlap between high peak frequency and sinus node and conduction pathways. While in 6 sinus syndrome, you see no overlap. So the sinus node is a low frequency. And so we performed some calculation. We saw that at emphasis peak frequency map, there is a good overlap between this 350, 450 band, both with the sinus node and also with conduction pathways. And also we saw that in 6 sinus syndrome, there is a lack of the superior pathway in most of patients. So interesting is also that the maximum peak frequency inversely correlated with the patient heart rate. So the higher is the patient heart rate and the lower is the maximum peak frequency. We don't know why. Maybe it's endo-AP near field versus far field. So it means that the higher is the heart rate, the more the sinus node goes to the epicardial side, so to the superior side, and so maybe there is more far field. So why this is important? This is important from a clinical standpoint because, of course, as Professor Garaviri, Professor Stephen Williams showed, we can import now the peak frequency on the OpenEP, so we can do a peak frequency analysis from multiple systems with the OpenEP. And actually, it's a news of today that we can do this with the Insight now, so we will start beginning from tomorrow. No, tomorrow is Sunday, maybe Monday. Maybe we will start. And then we will have a peak frequency to guide procedural Bachmann bundle implantation. So actually this is a project that we are doing with our responsible for device, Dr. Vera, and that will speak after me in the afternoon. And we are doing the peak frequency to guide during the procedure the Bachmann bundle implantation. So our colleagues from Minneapolis had the opportunity to see one of these implantations, and we look forward to a collaboration also with the Visible Art Lab on this topic. In conclusion, so the mapping of the sinus node is complex, following its nuanced and unique anatomical structure. Accurate definition and high density mapping of sinus node is the key for success in catheter ablation, and peak frequency mapping of human sinus node opens new frontiers towards understanding sinus node physiology and novel therapies. Thank you.